Today we're going to talk about anxiety and prostate cancer. We've read your comments, and I've spoken to thousands of prostate cancer patients who've dealt with anxiety, and we want to speak up about this because we want you to speak up. So today we're going to talk to Dr. Mark Scholes, who's a medical oncologist in prostate cancer for over 30 years, and find out how he talks to patients about anxiety when they're deciding upon treatment or in the process of having treatment. In today's video, we're talking about anxiety. Now, when it comes to prostate cancers, there's different areas of anxiety. There's the difference between being newly diagnosed or deciding upon a treatment. If the treatment's working, there's a lot of different areas. But I thought we would start just at the baseline. When you have a patient who is being, in the process of finding out, do I have prostate cancer or not? And they have those levels of anxiety, what do you tell them to help alleviate some of their concern?
The most anxious people I see are the ones who are newly diagnosed, who are starting to be introduced to this concept of having cancer and haven't been exposed to a broader sense of how different prostate cancer is. And it's just a very unfamiliar territory. And there are many dangers, of course, from the disease itself. There are dangers from making mistakes, getting the wrong treatment. And all this comes very suddenly at first. I find people calm down a lot when they get a sense that they can find some expertise, that some competent, reasonable resource to help guide them through the process. And if they can connect with that sense of competence, they can slow down and relax and enter into a process of trying to parse out what to do. It is a very frightening process. There's just a lot to learn really quickly, and there's many times a false sense, but there's a false sense that the clock is ticking and that you're under pressure to make a decision about how to treat. There's a different type of anxiety, I think, in people that have been living with prostate cancer for many years, and I don't think the anxiety ever completely disappears, but there is an experience that people gain over time that maybe allows them to handle their anxiety with a little more success.
Before I get to my next question, this September we're having an in-person conference for prostate cancer patients and caregivers. We want you to get your questions answered by leading physicians from all over the world, so you can learn more at pcri.org. Also, please subscribe to our YouTube channel. When you do this, it tells the YouTube platform that this video was helpful for you, and they'll push our videos out to other people who need help with prostate cancer. Now back to my conversation with Dr. Scholes. So you mentioned two things in the previous scenario with a patient being newly diagnosed, and one was timing and a false sense of urgency. Can you expand on the timing of prostate cancer? Because this was a big topic in one of our previous videos, and it seemed to give people a lot of peace because prostate cancer is slow growing and there is time.
Yeah, I think what we shared in that video, which is well worthy of being shared again, is in the early years prior to radiation becoming what it is today, surgery was pretty much the only treatment and hope for cure in the early years, let's say in the 1990s and early 2000s. The surgeon you used was critically important. There's a super big skill factor, and there were just a small circle of names of known doctors that had some success at getting the prostate out without leaving you in diapers and without making you impotent. They still left some men in diapers and some men impotent, but their rates were much better than the rest. So these few doctors that were well known throughout the country had long waiting lists of people who were willing to postpone treatment because they wanted that doctor to do the operation. And some industrious people then went back and looked through all the records of these patients, many of whom waited more than 6 months for their surgery, to determine if people that postponed treatment had worse long-term outcomes than the ones that got their operation right away. And the interval that they looked at was a 6-month delay. Reassuringly, they discovered that the patients that waited 6 months for their operation had the exact same cure rates as the ones who got immediate surgery. So I think that's a comfortable interval for people that are just getting thrown into this crazy world of prostate cancer. Evidence indicates that people that are candidates for surgery are not endangering their lives by taking time up to 6 months, and probably a lot longer, honestly, but up to 6 months to figure out what the best treatment is for them.
What do you tell caregivers who also are working with the patients to help them decide upon treatment, but they have anxiety together as a couple? I understand that there's a lot of, support that the caregiver is giving, but there's also the concern of, am I supporting him and encouraging him towards the right treatment?
When we see new patients, we encourage people to bring other people along. There's a lot of information that comes out real quick, and two heads are better than one. So I think you could apply that same principle to managing the emotional side of and the struggle that people face when confronted with big decisions that have long-term repercussions and consequences. Just having two or a second and a third person present when you're consulting with experts is very wise, and it counterbalances also the power in the room.
So what about in situations where you have patients who are waiting to see if a treatment is effective? I know a lot of times I've talked to newly diagnosed patients, or even patients maybe just starting hormone therapy, and they're going, I just want to know what my PSA is. I just want to hear whether this is working for me or not. And that amount of time between finding out whether or not starting the treatment and finding out whether the treatment is actually effective is quite hard to deal with. And there's a lot of anxiety that builds up in those time periods.
I have a number of patients who, let's say they've been in remission for 3 years and they're getting a PSA checked every 6 months. They had radiation or surgery 3 years ago. And a number of patients have said they want to get their PSA results back quickly because they are reminded of the implications of their status when they go in and have a blood test. They've been able to put it out of their mind pretty much for the previous months when they weren't checking their PSA. And now that, however, it's brought to that they understand, boy, this is a monumental thing. If my PSA is rising, then I'm going to be facing recurrent cancer, and it makes them quite anxious. So these are very stark reminders of our vulnerability, both of our longevity and then quality of life as well, because if you have to go back on hormone treatments or something like that, that can severely injure your quality of life. So I have one extreme, very intelligent man who asks that we only call him if his PSA is out of line. And this is unusual, not the norm, but it gives you an idea of how much people do struggle with this sort of thing. He doesn't want to wait that interval of time, and so he says, if I don't get a call, I'll know everything is okay. And that's not actually a good policy for medicine in general, because what if they lost the PSA or something? But he trusts that the system is reliable enough and doesn't want to hear from us. It doesn't want to get that phone call that everything is okay, which is our usual policy. We call patients to tell them their PSA. I don't have an easy answer for how people compensate for these different struggles and uncertainties which relate to our most valuable asset, our health. We see every day in the practice. I don't know that we have a good answer for it.
Recently, I was interviewing a hormone therapy patient, and he was experiencing a lot of anxiety while on the medication. He didn't really have a lot of anxiety before that, besides, deciding upon treatment in the normal prostate cancer experience, but it seemed like the medication enhanced that. Do you ever give anti-anxiety medications to patients who are undergoing treatment? And if so, which ones?
Very rarely do we prescribe anti-anxiety medicines. Just that's not really our qualification. But you say, well, do you refer patients to psychiatrists for anti-anxiety medications? Again, not very commonly. What this patient is describing, however, is something that is associated with low testosterone, and that is in men who've had testosterone since puberty, the removal of testosterone will frequently translate into a more intense sensation of all emotion, and anxiety would be one of those. And that goes away when men stop the hormone treatment and their testosterone returns. Some men enjoy this greater sense of emotional fluidity. Other men don't really care, and there are others that find it distinctly unpleasant and disquieting. In the third group, there are medicines that are usually prescribed as antidepressants, which in very small doses seem to take men with low testosterone back to the way they felt when they had testosterone at normal levels. And these medicines are antidepressants such as Zoloft, Celexa. Very small doses seem to make these men who feel this concern about their over-emotionality, maybe their anxiety, feel more like they used to feel when they had testosterone.
There may be patients who are clicking on this video and experiencing anxiety right now. So what would you tell them, as they're going through this process of being diagnosed with prostate cancer and maybe choosing treatment, or maybe they're on treatment, and how you've seen prostate cancer patients do over time?
One of the most calming things is if patients can find a competent expert that they feel is giving them state-of-the-art information. I think one of the biggest fears is that there's something out there that could help, but you're not hearing about it and you're missing it. So if everything is a foregone conclusion, the situation is going to go in a bad way, I can live with that more easily than if I knew there was something that I could have accessed, but I didn't hear about it. That, I think, is becoming more and more challenging in our rapidly changing world. There's so much new stuff coming out. There was more consensus 20 years ago on what the right and the wrong treatment was back then, because the treatment options were more limited. The patients that will take the time to teach themselves, I think, are the ones that are going to be able to overcome this struggle with uncertainty and anxiety that is pervasive in this world. The professional industry that's supposedly trying to help all these people oftentimes is at cross purposes to creating a calm, settled atmosphere for people to process information in. In other words, there's a lot of anxiety-provoking things that the industry does. And I don't think it's intentional, but there is certainly financial gain for the industry to encourage patients to make quick decisions. Time is money in the medical world, and people that have many questions and are looking at different angles from a physician point of view sometimes are just taking up their time. And so the idea that minimizing the feelings and maximizing the need to save your life with a sense of urgency is a very anxiety-provoking thing to do, and it's understandable that the industry wants this sort of a let's make a decision and move on type mentality, but I think it creates a lot of anxiety at the same time.
As we heard Dr. Scholes mention it, education is a great way to combat anxiety, whether that's learning about your own particular case, knowing the treatments that are either in front of you or that you're on, knowing what the side effects may be. All of this is just good information to have so that you can know what to expect, and then also creating a plan for the future should a treatment not work. Luckily, in prostate cancer, we have a lot of different treatments, and there is a lot of sequencing that can be done. And also knowing that you have time, that prostate cancer is slow growing, and even in the worst cases, in previous videos, we've interviewed other experts, and they always say you have a couple of months to really decide for you, what is this treatment, how am I going to handle it, and what are the side effects, and what's my plan for that as well. And that's all very important information to keep in context. One of the biggest issues I personally see in the prostate cancer world is that men suffer in silence. And there are a couple of things that other patients have mentioned, different methods that they've used to combat anxiety that I just thought I'd mention here. And everything is personalized to you, whatever works for you and your beliefs. But some patients meditate, some patients pray, some patients, join a support group, and they build up a community of other prostate cancer patients. And we can link the description, in the description below this video, of the support groups that, they may just be helpful for you. But some patients talk to their partner, some patients don't have a partner, so they need to talk to a friend, whether that's a family member or just somebody that they know in their community. But I would really encourage you to not suffer in silence, and don't go through this alone. Many patients they get insular. They deal with these issues alone. And I really hope that you reach out, that you realize your questions are valid, that your concerns are valid. What you're going through is so valid. And cancer itself is enough to deal with, but being insular on top of that makes the situation worse. And, maybe you're somebody where you've dealt with a lot of things by yourself before, but maybe a mental health expert can talk, be helpful. Talking to somebody, and just even in the privacy of maybe it's not a friend, maybe you don't want it in your community, but maybe you need that professional help, and maybe you want it to be in a private setting. Oftentimes I have seen this help patients. So please make sure that you're taking care of yourself, your mental health and your emotional health, your spiritual health through all of this, because as you go through anxiety, you want to alleviate as much as possible so you can be clear-headed as you're making those decisions, and you can have a good quality of life, because it really matters. Now, if you would like to talk to our helpline, these are prostate cancer patients, and they've been through this experience. They can give you just their experiences, but also answer a lot of questions. They have great information, and you can reach out to them at pcri.org/helpline. Please remember, most of all, you're not alone. and I hope you have a great week.